In 2002, the St. Roch Haiti Foundation began its partnership with the people of St. Roch, a rural community set high up in the hills above Port-au-Prince. Over the last 15 years, our catchment area has extended far into the surrounding communities and into the urban region below. The population we serve is severely and chronically impoverished, lacking access to basic resources and services. Our mission is twofold. Each day, we strive to provide our patients with consistent, high-quality health care, while also working to ensure that each individual has the resources and opportunities they need not only to survive, but truly thrive in the pursuit of their dreams. From a converted home operated periodically by traveling clinicians from the U.S., we have grown to a comprehensive community healthcare center. From a handwritten logbook with 100 registered patients back in 2002, we now are transitioning to electronically managing more than 37,000 registered patients. Patients rely on our in-country clinical care team more than ever before. SRHF's full-time staff of local clinical and administrative professionals operate the clinic 5 days a week, and their dedication to providing their neighbors with the best possible care inspires the Foundation's work of each day. We offer our patients comprehensive primary health care with an on-site lab, basic electronic diagnostic tools, a newly renovated dental suite, and a pharmacy where patients receive medications ordered by the care team. Our treatment capabilities are at an all-time high. But our clinical reach also extends far beyond the walls of the SRHF clinic. Our 5 community health workers and weekly mobile clinic allow us to serve and manage patients who are unable to reach the clinic. As SRHF has evolved over the last 15 years, we have found that improving population health requires a multifaceted approach. Education, jobs, and nutrition are major contributors to improved health outcomes. This has led to the continued growth of our community development programs. Our initiatives to support childhood education began many years ago with sponsorship of primary education. We now sponsor more than 200 students. In 2015, we also added a university scholarship program, generously funded by the Flatley Foundation. We proudly witnessed many of those students, whose education people like you supported from a young age, pursue their improbable dream of earning a college degree. With most Haitians living on less than $1 per day, SRHF began its microfinance program in 2007, awarding loans to 15 women to start their own small businesses. Today, more than 100 women are enrolled in this program. With her microloan, Antonine Dominic built a small storefront that provides the community with a place to buy and sell cooking supplies and other essentials. Bolstering the local economy, this opportunity has allowed Antonine to provide for herself and her sons. With the vast majority of families in St. Roch relying on subsistence farming to survive, community agriculture has been a long-standing, locally led initiative. Throughout Haiti, unsafe water and poor sanitation exacerbate an already high maternal and infant mortality rate. After several years of research and testing, construction on the Clean Water Initiative began in 2009. The project is now pumping water from a clean mountain spring to several locations, increasing access to clean water for all. With our community development and clinical programs working in harmony, we are laying firm roots for the next generation. In this last year alone, we have added a new dentist to the SRHF clinical team, expanded our community agriculture initiatives to strengthen the malnutrition prevention program, initiated significant improvements to our medical record system, began laying the groundwork for mental health care in St. Roch, and we have started to take steps towards turning our dream of building a new facility into a reality that will allow us to provide our growing number of patients with dependable access to the dignified health care they deserve. With your support, we have accomplished all of this, all while continuing to empower community members to advocate for their needs and design sustainable solutions to complex issues. One of the most evident examples of this locally driven teamwork was the community's response efforts in the wake of Hurricane Matthew. Homes were completely destroyed, the community gardens were decimated. Within hours of the rain stopping, our Haitian operations team jumped into action, visiting every family in the community to provide immediate relief assistance and compile a comprehensive needs assessment. The response in the United States was equally as swift. Donations came pouring in, and we were able to raise more than $38,000 to execute the long-term relief plans developed by the community, exemplifying the true power of our partnership. And with labor volunteered by skilled community members, they have rebuilt and made critical repairs to homes for more than 30 families. Hurricane Matthew has faded from the headlines, but the work in St. Roch will continue over the next several months to ensure that the community is rebuilt with the strength to weather the next storm. In 2002, the people of St. Roch identified healthcare as their greatest need. Over the last 15 years, our relationships have become stronger and our conversations have become broader. Inspired by the humanity of those we serve, we are working together to develop a comprehensive plan to treat the whole patient. Today, SRHF, in coordination with the St. Roch community and a committed donor base in the U.S., has cultivated dynamic paths to success for the people of St. Roch. There is still so much more work to be done, and with each new day, we are building hope together. Join us.